From IBMTV World Headquarters in Raleigh-Durham, North Carolina, and from New Delhi, India, we present the Health Channel. Hi, I'm Nick Palavita, along with our host, Ankit Kandalwal. We'll have a special guest, Dr. Sahil Bagai. Doctor, welcome to the show.
Thank you, Nicholas.
Okay, so what we're going to discuss today is, who you are and where are you from?
Yeah, my name is Dr. Sahil Bagai. So I am currently a practicing nephrologist and a renal transplant physician, practicing at Saket, Delhi.
Okay.
So I did my specialization from Postgraduate Institute of Medical Education and Research, Chandigarh, and so currently in practice.
Okay. Can you explain to our viewers what is nephrology?
Yeah. So nephrology basically deals with your kidney structure and function. And in case your kidneys are not able to support your daily life, then we deal with the transplant.
Okay. So the thing is, it deals with your kidneys then.
Yeah. So I basically am a doctor for the kidneys.
Okay. Right. And so did you go to school in Delhi or in the United States, or where did you do your training at?
My all schooling has been in Delhi. The specialization as a nephrology training has been in Chandigarh. Otherwise, everything in Delhi.
Okay. All right.
Since how many years you are practicing nephrology?
Sorry, Ankit?
Since how many years you are practicing nephrology?
It's total been 6 years now.
6 years. So nowadays we are seeing a trend that chronic kidney disease is all-time high around the globe, and still people are not, ready to go for the dialysis or transplant. What's your take on this?
Yeah, the issue with the chronic kidney disease patient is that there are no clinical symptoms which can bring you to your physician's notice. So basically, they would only be picked up if you routinely get your labs done. And in India, since most of the patients are not wanting to go for screening, so we miss majority of our patients in early stages of chronic kidney disease. And whenever we see the patients, they presented late in these CKD stages, and that's when we have already missed the bus.
Okay. And what are the causes of chronic kidney disease, and is there any particular age group or disease which makes those disease more severe to other patients?
Chronic kidney disease can affect anyone, right? From your birth, you can have some anomalies in the kidneys which can predispose you to chronic kidney disease in future. Or even in adulthood, there are diseases which have genetic association but can predispose you to chronic kidney disease. And obviously in adulthood, with the diabetes and hypertension taking toll over your body, so then even one can predispose themselves to chronic kidney disease.
Great. And what kind of cases you are handling in the chronic kidney disease? Is there any bifurcation, or how you take from the starting? Because it looks like a vicious circle, because if any patient will come on board for dialysis, it's a day-to-day running job for them.
Yeah. So as I said, that the problem in developing countries and what we experience as a practicing nephrologist is that the people don't come to us early. So as I said, that's the time. If the patients come to us early, that's the time when we can intervene and delay the progression to the chronic kidney disease. But our patients, unfortunately, present to us in a state where we have clinical symptoms already there. Labs suggest that they are in the end stage renal disease, and that's the time when we have to initiate dialysis for them. And if dialysis is not done, then transplant is given as an option.
Great. And what kind of practices we are doing in nephrology service in India as compared to US? Because I believe still insurance companies are not, coping up well with the nephrologist patients in India as compared to other developing countries.
Yeah. So the basic difference between the US and Indian healthcare is the amount of GDP which is spent on the healthcare. So US it's something about 17% versus 1% in India, and which is I think which is the crux of all the problems which we face in our daily practice. In India, hemodialysis, peritoneal dialysis, and transplants are the three things which we can offer our patients. So in India, most of the things have to be incurred from your pocket. If you choose hemodialysis, even then you have to spend from your pocket. Peritoneal dialysis is not covered by insurance companies. It's not government coverage. So everything has to be spent from your pocket. So we just give our patients all the options upfront, and we ask them to be involved in the decision making. So whatever they choose as the best modality of dialysis is offered to them.
And how long a patient can survive if he directs with the chronic kidney disease? I mean, what's the lifespan?
With the advancing technology and the better techniques coming up, the survival on dialysis has increased appreciably. And we see that 15 to 20 years is not something which is not expected in our dialysis patient. And recently, one of the patients from Great Britain had Guinness Book record where he survived 33 years on dialysis. So I think that 33 years is a huge number.
Huge number, yeah, certainly. So, is there any difference in terms of dialysis or transplantation technology in India and comparing to the rest of the world?
We have been almost there at par with the West now. We have recently had the chance to even use the robotic surgeries, and we have been doing it for our patients. So, as in terms of clinical acumen, we are almost at par. But as I said, that the problem is the total amount of GDP which the government spends on the health. So, the maintenance of the disease is what the problem is.
And what kind of numbers we are, seeing on in terms of transplant happened in India and in the world year-on-year basis?
So again, the difference in India versus the West would be that in India the awareness is low on cadaver transplant. So there would be very minimal disease donor transplants. So we heavily rely on live donations for our transplant program. And so out of 200 yearly transplants that are done in our center, we would have almost like 95% which are live related.
Okay. But still, what's the total number in terms of transplant happen in India?
So the transplant happening in India would be somewhere closer to 15,000 a year.
15,000 a year.
Out of these, almost like 6 to 7,000 would be in New Delhi.
Wow. And what's the success rate of those 15,000 transplant?
So the success rate is again comparable to as we see in West. So 97% at the end of 1 year, 95 at the end of 3 years, and closer to 85% at the end of 5 years.
You want to ask something?
Yeah, are you, Dr. Sahil, are you seeing Americans flying over to India to receive medical treatment currently? In other words, to get away from the high cost of medical treatment here?
We have Nicholas, but not in huge numbers.
Okay. Right.
Because in transplants, as per the government, there has to be a close relation which needs to give us the kidney. So establishing a relationship might be a problem, and then there would be a problem with the embassy getting permission from the embassy. It's a lengthy process.
Okay. What are the symptoms of kidney problems? So you're getting these people usually late in the game. Yeah. What should somebody be looking for in terms of knowing that they have kidney problems?
So chronic kidney disease is divided into 5 stages. So stage 5 is the one where you would have most of the clinical symptoms, and these symptoms would bring you to your physician. And by the time you reach your physician, it's already late. So 95% of the cases would not be reversible at this point of time. So CKD stage 1 to 3, where in the nephrologist role comes in stopping the progression of a disease. During this time, unfortunately, we have minimal symptoms. Patient might say that he was absolutely fine for the last couple of years, But seeing the lab, we can conclude that he was having this problem since long. So what I would say for the viewers would be, if you have diabetes, if you are hypertensive for long, if you knew that you had some genetic problem in your family, you must and must go for routine labs so that your problem is addressed early in the CKD phase.
So the best we can say is that prevention is better than cure. So
Yeah,
I mean, if we start with at the age of 30 and we can keep on checking our labs and reports and be in touch with the doctor, physician, or a
yeah.
nephrologist, we can
If
sustain a better life.
if someone's parents are diabetic, then there are chances that the progeny would have diabetes in somewhere closer to 23% of cases. So these are the persons who must be more considerate for getting a labs on regular basis, and these are the subset of individuals in which we can help on routine screening.
So do you have
This
any prevention campaign or a prevention program for people who could be possible CKD patients in future? Anything on that
uh,
line?
I think the role of primary physician stands more than the nephrologist, because they are the ones who would encounter the patient early in the life. Not everyone would turn to nephrologist, so they are the ones who must be more aware of when to refer the patient to a nephrologist and when to think that the nephrology problem might be there in the patient.
And how busy is our nephrologist doctor in OPD as compared to the basic intervention working with the patient directly rather than writing this OPDs?
So, the nephrology practice revolves around OPD. So, and we have most patients which we have in our inpatient are critical. So, yes, a nephrologist's life is busy, and if you want, you can keep on continuing to work for 24 hours, and even then, you will not be able to satisfy most of your patients.
So is this disease like a vicious circle where a person, if affected from nephrologist, it's like a daily or a weekly routine for them to go to the doctor and visit and then do the dialysis and then again see the doctor getting the reports done.
Yeah. So unfortunately, once you have chronic kidney disease, so it's going to be a vicious cycle wherein you have to undergo hemodialysis on a regular schedule. So it has to be at least thrice a week. If someone wants to break the vicious cycle, then obviously the transplantation is there. But then seeking donor and looking about the expenditure, which is again a major problem in the developing countries, is a hurdle to transplant.
So for our viewers, we would like to understand the difference between hemodialysis and the transplant surgery. What kind of process are there, and what patient should opt for a dialysis or a transplantation at a particular point of time. So what's your comment on that?
The success rate for transplant is appreciably good, so it's closer to 97% at the end of 1 year. So in all our patients, and for that matter across the globe, all the nephrologists would be putting transplant before hemodialysis or peritoneal dialysis. So even for our patients, transplant is the answer. If, however, they say that they cannot incur the expenditure, if they cannot have the donor, or if the donor is rejected medically, then obviously they are forced to be on dialysis. And for the viewers, I will tell you that hemodialysis is nothing, it's basically a purification of blood. So what your kidneys were supposed to done in your body is being done by a machine outside your body, wherein we subject your blood to purification for 4 hours, and this happens with the help of a filter. And these are all commercial filters, and after 4 hours, whatever purification has been done, we believe that it's good for at least for 2 days. So we say that our patients should be maintained on thrice per week to at least take care of the health.
And what are the pros and cons for dialysis patient? And I believe dialysis is an artificial filtration of
Yeah.
kidney, and kidney is a natural filter basically.
Yeah.
That's how people sustain and clean their blood and remove the excess water from using dialysis.
Yeah. So dialysis per se has two important functions. One would be to remove the uremic waste, which would be the waste which gets accumulated when your kidneys are not functioning. And second would be to remove the extra amount of water, since your urine is not coming to the tune of what it was coming before the kidney injury. So in the dialysis, what, as I said, what happens is your blood gets purified through a filter, and this blood via the filter goes to your body. This process continues for 4 hours. And as compared to peritoneal dialysis, wherein your abdominal cavity acts as a natural filter.
Is there anything that people should be doing to help prevent kidney disease?
Yeah, Nicholas, as I said, that kidney disease, basically, kidney disease is all about prevention. Once you have a kidney disease, there is no going back. There's always looking forward, and there is always going to be a progression of your kidney disease, and your stage would progress no matter what you do. It's just about how fast or how slow can we decrease the slope of this progression, and there's what the role of nephrologist. But to say that we can cure the disease, it's not possible.
Is it more prone to diabetic patients than other people who are suffering from small other injuries?
Yeah, unfortunately, diabetics have a slope which is more steeper than normal patients. So these patients would progress more towards end stage quickly than rest of our patients.
What
And
about smokers? Do smokers tend to
Yeah,
have more kidney problems?
yeah, yeah. So if a patient is identified in early CKD phase, so that's stage 1 to 3, then if we can convince them to stop smoking, then the progression of the disease can be halted for some time. However, if the patient already has progressed to stage 5, then stopping smoking per se would not benefit him much from the kidney point of view. But obviously, overall health would always improve when you quit smoking.
And
Okay.
what's the role of the weather in for the CKD patients? As of now, Delhi is suffering from a big smog continuously from 15
Yes.
days. So how the patient can be take care of their health and wealth in terms of
Good
Yeah,
point.
the smoke has been a big issues, and it has been in the limelight. Delhi has been in limelight for 15 days.
yeah.
So this smoke would obviously affect even healthy individuals. So individuals whose immunity is low, they are bound to suffer during these days. So what I'll suggest is that minimize the movement outside your house. Obviously, you can't ask them not to get dialyzed, but
Right.
any extra movement outside the house which can be curtailed must be done. No morning walks, no evening walks. Taking care of your health in a better ways. Keep yourself hydrated as per your nephrologist's instruction. Keep your diet healthy during all this time. Would always help you.
And back to transplantation. So people still believe that transplantation is one of the tedious surgeries to be done, and then it not only reflects one's life. There is always a second life, which is also in the surgery scenario. So, what is the role of a donor for a transplant patient?
Yeah. So the transplant program can only exist if you have donors. So if you don't have donors, your transplant program is going to get stopped at some point of time. Donors' health is much more important than the recipient health to us. So if we find that the donor is unsuitable, even we keep a very low threshold for these individuals. So even a slightest hint that these patients might not do good in future after donation, will not ask them to donate and look for alternative donors.
But there are a lot of legal aspects to it, and different countries have different legal foundations for donors. And so, how we can,
Yeah.
fulfill a good donor or maybe a prospective donor for a, transplant patient.
So whenever you have transplant, there comes the talk of organ trafficking. and I think that's the role of all the government policies where they curb this organ trafficking. So in India, basically what the government has done is we have not allowed any unrelated transplants. So only your nearby relatives can donate kidneys. Nearby relatives means your first degree relatives, your grandparents, your parents, your spouse, your children, and your grandchildren. These are the individuals which are by law permitted to donate kidney.
And can we get donation from, prospective accident patients who were, brain dead or who have
Yeah,
accidents and
yeah.
their,
So unfortunately, if the family doesn't have a donor, we do have a provision in India similar to we would have in states that the patient's entry is done in a cadaveric register, wherein they'll be allotted the organ as per the availability, as per their names on the waiting list. So we do have a provision, but as I said in my early phase of a talk, that people are not that much aware because of their religious misbeliefs. They'll not be wanting to donate the kidneys even after death. So that's the basic problem which we face in India.
Okay.
and nowadays we also heard about artificial kidneys or, replacement of kidneys with the surgery, and then that particular chip can filter out your water or purified your with the help of different organs. Is it something
Yeah, the
going on in
people.
the coming years?
Yeah, the people have been trying very hard to come with artificial kidneys, and some work has been done in this field in the West. We are yet to get a FDA approval for the same, but things are in pipeline, and we seriously hope that something better comes for our subset of patients, so that the pain suffering decreases to our chronic kidney disease patients.
Great. And if you talk about your achievements, do you want to further go for any particular, expertise in terms of surgeon or maybe doing kidney transplantation yourself?
Yeah. So fortunately, in India, during our training, most of the things which a nephrologist should know is taught to us. So basic surgical skills, wherein making someone's vascular access is all known to us, and we do it routinely. Doing a transplant surgery is transplant surgeon's domain. So I think the nephrologist would not be too willing to enter that field. But yes, we'll be limiting our surgical expertise to creating fistulas, putting in catheters, and helping patients doing dialysis.
Great.
All right. Well, we're running out of time now, but we do want to thank Dr. Sahil for being on IBMTV and contributing to the Health Channel, and hope this helps people out that they recognize some of the problems and they seek medical help before the issue takes place, because it looks like that would help them out quite a bit. So thank you for being on IBMTV, and thank you, Ankit and Dr. Sahil, for
Thank you
coming
so much.
to the Health Channel. Thank you very much.
Thank you.
Thank you so much.